and resilience is fostered. Thank you, and may we continue to work together towards a healthier and brighter future for our beloved nation. Marami pong salamat.
Thank you, GM Robles. At this point, may we request the President to lead the turnover of the patient transport vehicle keys to 5 regional representatives of their local government units to be assisted by Special Assistant to the President Antonio Ernesto Lagdameo Jr., PCSO Chairman Felix Reyes Jr., and PCSO General Manager Melquiades A. Robles. May we call on stage the following: Car Region Mayor Shamir Pulot, Municipality of Calanasan, Apayao. Thank you, Mayor Shamir. For Region 2, Mayor Cesar D. Jr., Kawayan City, Isabela. Thank you, Mayor D. For Region 3, Mayor Giselle Vistan, Municipality of Plaridel, Bulacan. Thank you, Mayor Giselle. For Region 4, Mayor Dalia Loyola, City of Carmona, Cavite. Thank you, Mayor Dalia. And lastly, for Region 5, Mayor John Vincent Fantebella, Municipality of Sangay, Camarines Sur. Thank you, Mayor Fantebella. And thank you, Mr. President. At this juncture, may we invite Special Assistant to the President, Antonio Ernesto Lagdameo Jr., to introduce our guest of honor and speaker.
Ladies and gentlemen, His Excellency, President of the Republic of the Philippines, Ferdinand R. Marcos Jr.
Thank you very much to the Special Assistant to the President, Secretary Anton Lagdameo. Please just take your seats. PCSO Chairman, Chairman Felix Reyes, the PCSO General Manager Mel Robles, and the other members of the Board of Directors who are here with us, our host city for today's activities, Manila City Mayor Maria Hani Lacuna Pangan, patient transport vehicles beneficiaries. Nandito yung mga iba't ibang mga alkalde natin nagre-represent doon sa kanilang iba't ibang rehiyon. At yung iba napunta na rito dahil ayaw na nilang antayin at ida-drive na nilang pauwi itong mga ating bagong mga transport vehicles. Kaya nakita naman ninyo, hindi yung malaking susi na binigay ko, hindi lang symbolic yun, may susi talaga nakadikit doon. Kaya totoo na talaga ito. My fellow workers in government, distinguished guests, ladies and gentlemen, magandang umaga po sa inyo lahat. It is always a good day when we come together for the purpose of improving the welfare of ordinary Filipinos. I lead today the turnover of these patient transport vehicles to our 129 LGUs beneficiaries. A key initiative of the Philippine Charity Sweepstakes Office, the Medical Transport Vehicle Donation Program builds on our thrust to improve healthcare access and provide swift medical intervention, especially in vulnerable communities and geographically isolated and disadvantaged areas. The Philippines is located in the Pacific Ring of Fire, and therefore is in the pathway of some of these volcanic activity, also in the way of the storms, encountering an average of 20 tropical cyclones every year. These past weeks, we have already witnessed heavy rainfall caused by typhoons enhanced by monsoon rains. So that while we try to weather these storms, it is crucial we always prepare for the hazards and the potential disasters that come with it. That level of preparedness is the primary matter that brings us together this morning. The Medical Transport Vehicle Donation Program aims to deliver Type 2 Advanced Life Support Ambulances, PTVs, sea ambulances, particularly to underserved regions. Specifically, we will be giving these PTVs to provincial, city, and municipal governments to help ensure that their constituencies will be given the chance to pull through whenever they need these assets for the rescue, for the healthcare of those who have become victims to these natural calamities. These vehicles are vital resources to support our heroes in the medical field, our first responders. Kasama dyan siyempre yung ating mga healthcare workers, ngunit ay nanguna dyan talaga ang mga LGU. They will provide timely medical intervention by transporting patients to hospitals. Many times, these vehicles make the difference between life and death. Although we all share the same hope that none of us nor our loved ones should ever be in need of an ambulance, we welcome and greatly desire their presence in our communities. My heartfelt gratitude goes to PCSO for embarking on this endeavor. Since our first day in office, over 200 LGUs have now benefited from this program. I was also informed that you are set to procure even more PTVs to ensure that every single municipality in the Philippines will be equipped with 2 vehicles each. It is a vision worth every ounce of effort, so I enjoin each of you to stand firm, to press on, until we turn this aspiration that we have into reality, and we certainly can do it. While we still face numerous challenges in our healthcare system, this program aids us in elevating the quality of healthcare in the country. No matter how many hospitals and health centers we build, no matter how many medical health professionals we employ, and no matter how much equipment we acquire, it would all be devoid of meaning and purpose if patients cannot reach them in moments of need. I reiterate that the most effective and life-changing impact can only happen when we genuinely put the welfare of our fellow Filipinos on the top of our priorities. I expect that every LGU beneficiary will use these vehicles responsibly and efficiently, and urge the PCSO, the LGUs, other agencies to continue creating programs and projects that will bring life and security to everyone. I am confident that we can build a bagong Pilipinas where no Filipino will be left behind, be it in healthcare or in any other opportunity to live meaningful, prosperous, and healthy life. It is what our people need. It is what Filipinos truly deserve. And what you see here are 129 of the present 300 vehicles that are now with the PCSO. Wala pang kalahati ito doon sa na-deliver na ng PCSO sa iba't ibang bayan sa buong Pilipinas. At pinapangako sa atin ni GM Mel na magkakaroon ng 1,000 pa. Lahat-lahat ay 1,000 para lahat nga ng bayan, lahat ng lungsod, lahat ng probinsya ay magkakaroon nitong ating ambulansya or patient transport vehicles na ginagamit. Ang instruction ko talaga, nung kami bagong upo, ang instruction ko talaga kay GML, sabi ko sa kanya, alam mo, pagka pinag-uusapan ng ambulansya, healthcare na yan, buhay na ng tao yan. Dapat wag nang pinupolitika yan. Dahil alam ko naman ang sistema na nung gobernur ako, kung malakas ka, makakakuha ka ng ambulance. Kung hindi ka malakas, ay mababa ka sa listahan. Kaya ko hindi naman dapat pinupolitika ang healthcare system natin. Kaya siguro ay ang malaking pagbabago rito ay hindi na kayo pupunta sa PCSO o sa akin o sa governor ninyo o kung kanino, senador na kaibigan nyo, ang congressman nyo, sabi, pakiusap naman, wala kaming ambulance. Antayin na lang ninyo na may ambulansang darating sa inyo. Hindi na kailangan. Dahil nga, kagaya, paulit-ulit ko nasabi ito, galing naman talaga ako sa LGU. Kaya naintindihan ko ang pagpili nitong modelo na ito na ambulansya ay talagang inisip namin na mabuti. Meron talagang maganda na malalaki, na mamahalin at halos ospital na ang laman ng ambulansya. Ngunit hindi practical dun sa mga maliliit na bayan. Dahil na-experience namin ito na meron kaming napaka-denonate na ang mga nurse at saka doktor na Ilocano sa California. Nag-donate sila ng 2 malaking ganda-ganda na ambulansya. Nung mag-emergency, hindi makapasok doon sa maliliit. At ang ginagawa, sinasakay namin yung pasyente sa tricycle bago ilalabas para isakay ulit sa ambulansya. Kaya ito, bagay na bagay sa Pilipinas ito. Madaling ayusin kahit yung mga mekaniko sa probinsya na sanay ito dahil maraming pyesa, madaling ayusin ito. Kaya practical ang ating pagpili itong modelo na ito. Kaya yan ang ating hangarin na talaga naman ay maramdaman ng taong bayan na kahit papaano, sana nga hindi mangangailangan ng itong mga ambulansya. Ngunit kung dumating ang araw na may pangangailangan sila ng ambulansya, nandyan at meron magamit at gumagana. Kasi nga, yung mga iba, napakaganda nga, mga 6 na buwan lang, after 6 months, hindi na tumatakbo. Dahil walang pyesa, hindi natin alam ayusin. Ito, simple lang at practical para sa ating mga LGU. So that is what we are doing today. And that is why I'm very, very happy because it is a true service to the people. It is removed from political color. It is removed from all of these political forces, which unfortunately we all know was the way it was conducted before. So palitan na natin yan at tingnan natin lang, hindi na kung sino ang mga magkakampi, kung sino mga kaalyado, kalimutan na muna natin yan. Asikasuhin muna natin ang taong bayan. Maraming salamat sa inyo lahat. Mabuhay ang bagong Pilipinas. Maraming salamat at magandang umaga po.
Thank you, Mr. President. At this point, may we request the President to kindly grant us a photo opportunity. May we call on PCSO Board of Directors to please come on stage? Thank you, everyone. May I request the President to kindly proceed downstage for a group photo together with the distinguished guests. May we request everyone to please rise and kindly be closer to the President. Please move forward and be closer to the President. Thank you. Please move forward. Please come closer to the President. Ready in a count of 3, 2, 1. Thank you, Mr. President. And that ends our photo opportunity. And that concludes our program for this morning. Thank you, Mr. President. Once again, the President of the Republic of the Philippines, His Excellency Ferdinand Romualdez Marcos Jr.
Panahon na ng pagbabago, dahil sa ito'y kinakailangan. Tayo na magtulong-tulong na maunlarin ang mahal ng bayan.
Panahon na ng pagbabago.
Once again, the President of the Republic of the Philippines, His Excellency Ferdinand Romualdez Marcos Jr.
Napaunlarin ang mahal